about the part 3 temporomandibular joint. In this part, we will discuss about the movement which occurs at this joint and clinical importance of this joint. This is articular disc here. This is superior articular surface. This is inferior articular surface. Here is articular disc. This articular disc divides the joint cavity into upper and lower compartment. This compartment is upper compartment, this compartment is lower compartment. This compartment is upper compartment, this compartment is lower compartment. In upper compartment, the protrusion or protraction and retractions movement takes place. Here, hold this articular disc along head. It moves forward, anteriorly or backward like this. Forward movement is protraction and backward movement is retraction. So this protraction and retraction movement takes place in upper compartment. This is upper compartment. Here this movement takes place. Protraction, forward movement like this, and retraction, retracted mandible, protruded mandible, retract, goes backward. So this movement, protraction and retraction, is done by protraction, forward movement is done by lateral pterygoid muscle and medial pterygoid muscles. Two muscles, lateral, medial pterygoid muscle. And retraction is done by posterior fibers which are attached with this. Posterior fibers are a temporalis muscle which retract. Here you can see these are posterior fibers of the temporalis. Here are anterior fibers. This is posterior fibers which retracts protruded mandible like this. So protrusion, protraction and retractions takes place in upper compartment, and in lower compartment movement takes place, that is around the transverse axis and also around the vertical axis. So in case of opening of the mouth, initial stage of opening of the mouth, there is movement occurs in the lower compartment around the transverse axis. Around the transverse axis, here movement is like hinge. It slightly depresses the mandible. In case of wide opening of the mouth, like this movement is further followed by the movement which occurs in upper compartment, that is gliding movement. In wide opening, this whole part it moves forward by the lateral pterygoid muscle. So lateral pterygoid muscle is only opener of the mouth, and all these muscles are closer of the mouth, all three muscles. So protraction and retraction takes place in upper compartment. Here this movement is gliding movement, by the gliding movement. And in lower compartment, movement around vertical axis and around transverse axis. So, and another movement is, that is side to side movement. So protraction, retraction, depression, elevation. In case of depression, slight depression, initially there is movement around transverse axis. In wide opening or wide depression, large depression, like this movement around transverse axis is followed by gliding movement which occurs in upper compartment. So initial movement is lower compartment, then in upper compartment. in case of the opening of the mouth. In case of closing of the mouth, the movement is reversal to this. In case of side to side movement, one side, suppose this is left side, here this head of the mandible is fixed and rotate around the vertical axis, and this right side, the head of the mandible moves forward, like in case of protraction. This is side to side movement. In case of this, like this chin movement toward the left side. And if here it is fixed, then it moves, left side moves forward. So the chin moves right side. So this occurs in the side to side movement. In case of excessive opening of the mouth, this head, this crosses this articular eminence and it reaches into here, the infravertebral fossa. And if this occurs, then patient cannot close his mouth. In such condition, the clinician apply pressure on here, last molar teeth, here on both sides, like this, and then slightly elevate the chin. Apply pressure on last molar, then apply slight pressure over the chin, elevate the chin. Now, after doing this head from here to move its original point. So this is condition where this head of the mandible dislocate and how this dislocation can be reduced. So this is all about the temporomandibular joint part 3.